Welcome to Happy Learning. Now we will see complexities in adolescence. Adolescence is a period of stress, strain, storm and strife. The literary meaning of adolescence is to grow up. It came from the Latin word. There are three main stages of adolescence. Early adolescence, 9 to 13 years. Mid-adolescence, 14 to 15 years, and late adolescence, 16 to 19 years. Developmental characteristics of young adolescents. Adolescence is a critical period. During that period, they will be forming their identity. So, they will be having explosion with physical, intellectual, emotional, social, and spiritual intelligences. Developmental characteristics of young adolescents. Physical. They will experience with the onset of puberty, develop secondary sex characteristics, grow rapidly or often clumsy and uncoordinated, highly self-conscious about their body and image, fluctuate between hyperactive and lethargy. Need physical activity. Related with their cognitive intellectual, they have the ability to think abstractly, but many things literally, develop critical thinking and exhibit common communication skill, become argumentative, and then they have the skill of decision making. They show new interest in new studies. Related with emotional, they have more sensitive and prone to outburst, vulnerable to emotional peace and can be easily manipulated. They exhibit their capacity for empathy and sympathy. Experience highly sexual feeling, may engage in sexual behavior without realizing consequences. Coming to social interpersonal, they have more developed social consciousness, more aware about relationship and have a strong need to belong. They feel dependence on family to depend on peers. Able to critically compare parents with others and seek deeper friendship based on shared interest. Experience higher interest in opposite sex. Coming to moral, they feel to stick with rules and regulations, refine moral belief of parents but begin to test rules of childhood. They were influenced by the values of peers, form more personal conscience, seek moral criteria that make sense to them, exhibit stronger sense of responsibility towards larger society. In spiritual level, their faith identity shaped by families and communities. Opportunity primarily to connect with peers and test skills. Can be open to new prayer experiences. They seek adult role as model in authentic their faith. They have deeper relationship with God. Being more away from religious imagination, they have belief and practice of childhood. Many begin to explore new images of God. Now coming to the needs of adolescence. The needs are divided into primary needs and secondary needs. The primary needs of need of oxygen, water, food, rest, sleep and sex. The secondary needs are security, love, recognition and approval, achievement, freedom and independence, and self-expression. The needs of adolescence relates with the freedom from dependency, need for association with opposite sex, need for self-support, a need for philosophy of life. Now coming to the problems of adolescence. Common problems are excessive energy intake of food is increasing, the general health is also improved. The result is excessive energy. With the advent of adolescence, the conduct comes into activities for short time. The appearance of secondary sexual characteristic is to the same. They produce emotional upheaval in the adolescence. The first appearance of menstruational causes bewilders and shocks the adolescents. Common problems of the adolescents are information overloading, substance abuse, depression, suicide tendencies, loneliness, cybercrimes, gender-related problem, psychosomatic disorders and sex abuses. Information overloading, it refers to the difficulty a person can have understanding an issue and making decisions that can be caused by the presence of too much information. Solution. Filtering. Attention on useful information is needed. In substance abuse, the drug abuse due to peer pressure, addiction is problematic and it may cause violence and even death. So the causes were depression, suicidal tendency and loneliness. So what is the solution for the problem? Holding them back, listening them, communicating with them and counseling them. Coming to sexual abuse. Child sexual abuse, also called child molestation, is a form of child abuse in which an adult or older adolescents use a child for sexual activity. Special considerations for adolescents. Current developmental stage is related with ego identity versus role confusion. They search for independence and autonomy. They have black and white thinking. They have peer pressure, high risk behavior is seen, communication and support is neglected, and sexual issues and concerns also there. So common problem, what and all we can see in adolescence are aggressiveness or withdrawal, rebellious attitude, physical awkwardness, excessive daydreaming, emotional tension, economic independence, personal appearances, psychological problems, social problems, educational problems, so now we will see adolescence problem with reference to Indian context. Perplexity with regard to somatic variation is seen. They have problem related with intensification of sex consciousness. They have adjustment difficulty with parents, and a conflict is there between childhood and adulthood, and adjustment difficulty with school discipline and community. The major problems which we feel in India, our country, is misleading and misguided parents, teachers, friends, which happens, and they are ignoring the elders in getting the values and discipline. Half-informed or ill-informed, friends, brothers, sister, wrong-informed messages through TV serials, advertisement flames, and publications carry partial or fully false information. This leads to some psychological changes in adolescence. Adolescence problems are common to every country, but the way we tackle such problems from becoming more complicated is more important. An adolescent child is able to fall in a wrong path due to many misconceptions, and it is the duty of the parents, teachers and elders to correct them and provide them with a healthier life. Youth is the best asset of our nation, and by making use of that wonderful power, India can reach to superpower position. Every newborn once will pass through these stages, and it cannot be avoided. What are the managements of adolescence problem? What is the role of the teacher? Education for adolescents. Want to give adjustment with social discipline. Education for adolescents is to training in the art of living together, development of child entire personality, recognize individual differences, freedom of self-development, development of scientific attitude, value of interdependence, satisfaction of the urge for practical activity, physical exercises and activities, discouraging tight and sleeveless dresses. The role of the teacher in problem solving and proper physical, mental, emotional and social development of the adolescents is the role that a teacher want to give proper physical development, want to give proper mental development and guidelines for the children, proper emotional development, proper social development, that helps the children. And now how to help the adolescents for better adjustment. Provide suitable environment for proper growth, render proper sex education, proper dealing with adolescents, training of emotions, taking care of special interest, providing religious and moral education, providing vocational education and arranging guidance services. Adolescent stress. The stress is a state which is seen in response to internal and external stresses. Every system of the body responds to stress in varying ways. Stress endless changes affecting almost every system of the body, influencing how people feel and behave. Stress is a subjective sensation associated with various symptoms that differ from each of us. Stress is not only a synonym for distress. Stress increases productivity up to a point, after which rapidly deteriorates. Mental and physical health are the aspect of functioning that are mostly strongly influenced by exposure to stress. The main causes for stress in adolescence period are peer pressure, having boyfriend or girlfriend, conflict with relationship, peer rejections, pressure of school, moving to new town and home, moving to new schools, tests and homeworks, too high expectations, sports and other extracurricular activities, social backwardness, purported changes, too fast or too small physical development, family problems including abuses and alcohol, physical and emotional abuse and neglect, employment, and money problem. Ineffective coping strategies for adolescents are resignation, distraction, social withdrawal, wishful thinking, self-criticism, blaming others, skipping schools, bullying others, drug abuse. So how to find out the stress among children? The symptoms are irritability or unusual emotional behaviorism, sleep difficulties, nightmares, inability to concentrate, drop in grade, toileting or eating, headaches or stomachache, unexplained fear, anxiety, regression to early developmental level, isolation from family and other activities, drugs or alcohol experimentations. So how to cope with stress? Constantly changing cognitive and behavioral efforts to manage specific external and internal demands that are arising as taxing or exceeding the resources of the person. Due to that, stress appears. Voluntary and involuntary responses will be there. Temperament, reactivity and self-regulations, developmental impacts and subtypes of coping. So the role of the psychologist in schools: be familiar with common stressors, reinforce the importance of the problem, teach problem solving skills, introduce stress prevention and reduction strategies, educate, administrate the faculties, build up the mental health and the issues of the students and staff. Allow students to express difficulties. Teach problem solving. Use cognitive restructuring. Provide students to practice learned skills. Provide students to practical skills. Give good resources for finding new and effective mental health. Stress prevention and reduction techniques are: take a break from stressful situations. Autogenic relaxation, progressive muscular relaxation, visualization. Some of the most effective coping strategies for stress in adolescence, such as problem focusing coping, emotional focusing coping, social support through counselors and support groups, or through meditation, humor and exercise. Let all of us live a stress-free life. Live stress-free life.